MCQs, seizures and epilepsy. Q1, diagnosis of epilepsy. A 28-year-old man presents with 2 unprovoked seizures occurring more than 24 hours apart. Most appropriate diagnosis. A, single seizure disorder. B, provoked seizure. C, epilepsy. D, conversion disorder. Explanation. Epilepsy is defined as either 2 unprovoked seizures 24 hours apart or 1 unprovoked seizure with a 60% risk of recurrence within 10 years. Q2, first seizure management. A 40-year-old woman experiences her first seizure. No provoking factors are identified. What is the most important next step? A, start long-term therapy immediately. B, assess recurrence risk before initiating therapy. C, begin valproic acid immediately. D, initiate ketogenic diet. Explanation. After a first seizure, therapy depends on recurrence risk, investigations, and patient preference. SHAR Q3. Aura recognition. A 22-year-old man describes sudden deja vu and abdominal rising sensation followed by impaired awareness and lip smacking. Most likely seizure type. A, absence seizure. B, focal seizure with impaired awareness. C, myoclonic seizure, generalized tonic-clonic seizure. Explanation. Aura plus automatisms are features of focal seizures with impaired awareness. Q4, first-line drug for generalized epilepsy. A 19-year-old woman presents with generalized tonic-clonic seizures. Which medication is most effective as monotherapy? A, lamotrigine. B, topiramate. C, valproic acid. D, gabapentin. Explanation. Valproic acid is most effective for generalized epilepsy, but is avoided in women of childbearing potential when alternatives exist. Q5, first-line drug for focal epilepsy. A 35-year-old man has focal seizures with impaired awareness. Which medication is preferred as first-line therapy? A, valproic acid. B, carbamazepine. C, clobazam. D, phenobarbital. Explanation. Carbamazepine and lamotrigine are first-line choices for focal seizures. Q6, driving precautions. A 30-year-old man recently diagnosed with epilepsy asks about driving. Most appropriate advice? A, no restrictions are necessary. B, driving restrictions vary by province and must be followed. C, drive only when supervised. D, resume driving once medication is started. Explanation. Patients with epilepsy must follow provincial driving regulations, which typically require a seizure-free period. Q7, ketogenic diet. A 7-year-old boy with refractory epilepsy is being considered for non-drug therapy. Which dietary intervention may reduce seizure frequency? A, high-protein diet. B, ketogenic diet. C, low-salt diet. D, Mediterranean diet. Explanation. Ketogenic and modified Atkins diets may reduce seizure frequency in refractory epilepsy. Q8, drug choice in women of childbearing age. A 22-year-old woman with new idiopathic generalized epilepsy wants to avoid teratogenic drugs. Which option is safest? A, lamotrigine. B, valproic acid. C, topiramate. D, phenobarbital. Explanation. Valproic acid is most effective but highly teratogenic. Lamotrigine is safer for women of childbearing potential. Q9, refractory focal seizures. A 45-year-old man continues to have seizures despite multiple drug trials. Which intervention is next? A, switch to phenobarbital. B, consider epilepsy surgery. C, increase carbamazepine. D, lifestyle modification only. Explanation. Epilepsy surgery is an option for medically refractory focal epilepsy. Sudden drug withdrawal. A 55-year-old man abruptly discontinues clonazepam and presents with seizures. Most likely cause: A, new epilepsy syndrome. B, withdrawal seizure. C, stroke. D, alcohol intoxication. Explanation. Withdrawal of benzodiazepines, barbiturates, or alcohol can provoke seizures.